thyroid disorders and recurrent implantation failure. Thyroid hormone and TSH receptors are expressed in endometrium, granulosa, and ovarian stromal cells. Thyroid hormones influence blastocyst development, angiogenesis, immune function, LIF and LIFR expression in endometrial stromal cells. What are the physiological changes during ovarian stimulation which affect the thyroid hormone? Increase in estradiol level lead to increase in thyroxine binding globulin, which in turn decreases the free T4 and thus increase in TSH. So subclinical hypothyroidism, it is associated with increased miscarriage rate and lower live birth rates. So it is seen that thyroxine supplementation results in lower miscarriage rate and higher live birth rates. So even in case of euthyroidism, if it has been suggested that thyroid hormone replacement for TSH concentration above 2.5 microgram international unit, 2.5 micro international unit per ml is recommended. What is the dose of thyroid which should be given? In case of subclinical hypothyroidism, lower doses with 25 to 50 microgram can be started. But in case of overt hypothyroidism, the doses are started according to the body weight as 1.6 microgram per kg body weight. Coming on to autoimmune thyroid disease and RIF. Autoimmune thyroid disease is associated with decreased in CD8 cytotoxic T cells. It is associated with increased in TH to TC ratio. TH is CD4, TC is CD8. So the increase in ratio of TH to TC means CD4 to CD8 ratio. Thus, it is associated with recurrent spontaneous abortion. There is increase in TH1 to TH2 ratio. That leads to implantation failure. What is TH1? What is TH2? The elevated levels of TH1 cells are associated with rejection of embryos, whereas elevated TH2 levels are associated with pregnancy. Cytokines produced by TH1 cells such as TNF-alpha, they suppress the trophoblastic growth and promote inflammatory and thrombotic responses in maternal uterine blood vessel, thus adversely affecting implantation. So any change in TH1 to TH2 ratio will affect the pregnancy. So any increase in TH1 to TH2 will lead to implantation failure. How I have remembered is TH2 means 2, means mother and baby. So TH2 is the good thing. TH1 means mother only, baby is not there. So TH1 is bad thing. So that's how I have remembered it. So the conclusions associated with thyroid disorders are: thyroid autoimmune disease, it does not impact IVF-ICSI outcome in terms of number of oocytes, fertilization rate, implantation rate, clinical pregnancy rate. But thyroid autoimmunity has detrimental effect on course of pregnancy with increased risk of miscarriage rate and lower live birth rate. Okay, so overall, just again to conclude, although thyroid disorders have been various studies are there which have told thyroid disorders are associated with implantation failure, but statistical significance has not yet reached. But thyroid autoimmunity is definitely associated with increased rate of miscarriages and a poor pregnancy outcome. That's why the women who are carrying thyroid autoantibodies like TPO antibodies, those women, even if they are euthyroid, still the thyroid hormone monitoring is done in every trimester. This is the reason behind monitoring of the thyroid hormone. Thank you so much.